I'm trying to solve a problem related to peripheral arterial disease, which affects over 8.5 million people in the United States, or about 20% of people over age 65. The specific question I have related to peripheral arterial disease involves intermittent claudication, which is a condition that gives people pain in their legs when they walk or try to exercise. The main goal of my research is to help patients participate more actively in choosing what treatment they get and helping the physician decide how to manage their disease.
The pressures on the American healthcare system, they've never been greater than they are now. And those pressures are extracting huge tolls on all areas of American healthcare, but the pressures are accentuated in the areas of the academic medical centers. And those pressures are eliminating many of the mechanisms we previously had to develop young investigators and help them do scholarly work.
The experience we've had so far with this has been phenomenal. The patients participating in our focus groups have found it to be a very stimulating and rewarding experience. I think they in general feel empowered that they're being asked to assume a more active role in their own health care, including the choices of how they get treated. Early on in describing this research to colleagues, this is a little bit disruptive in that it shakes up the current way we practice medicine and interact with our patients. And it was interesting because there were some colleagues who felt like none of the patients would want to actually participate or make their own choices, and that they would all want to delegate that role to their doctor. And we have observed that that is not at all the case. They all want to hear all the treatment options and are very interested in getting more active and engaged in their own treatment selection.
Dr. Corriere is a very innovative person. If you look at other colleagues in surgery doing work, very few of them are integrating patient preferences into their activities. So I am absolutely convinced that as he moves forward with this will open up a new line of research and probably will allow us to expand patient preferences into other parts of surgery as well.
Awards like the Wylie Award, which there aren't many, it is one of the most prestigious awards in our field, allow us to develop these young investigators, to give them the tools they need to continue to compete for external funding to become independent investigators, and to allow them to network and meet other individuals who they can collaborate with, which is so critical as we try and develop mechanisms of doing research where we can garner large numbers of patients, bounce ideas off one another, and make the research truly generalizable to where it has an external validity that can be applied to patients throughout the United States.
Winning the Wylie Scholar Award is going to allow me to take this multidisciplinary project and move it forward to where I can actually improve patient care in a very meaningful and high impact way. This work incorporates a lot of different disciplines, including behavioral science, marketing and business research techniques, and regular old cardiovascular research, and integrating them together can be really complex, especially when you're trying to approach it from a standard funding agency. The Wylie Award has allowed me to take this idea that I regard as very innovative and take it to the next level to achieve a meaningful impact on patient care.
The Wylie Scholar is an appropriate position for bright young colleagues to enhance the practice of surgery. And Matt Corriere is a perfect person to move the field along and try to make it so that patients coming in for surgical procedures get optimal care, appropriate outcomes, and are part of the decision.